Good morning, Miss. This is Michaela Kubar and this is my CHN bag technique. So this is my CHN bag. And first is, we're going to put the thermometer, followed by the syringes. Next is, we're going to put the 2 test tubes and this as the test tube rack. Next is the test tube holder, followed by the droppers and the pipettes. And then here comes the solutions. First is the alcohol solution, the PNSS, the betadine cleanser, betadine solution, Benedict solution, the acetic acid, and the denatured alcohol. Next is, we're going to put the medicine cup. Medicine cup is followed by the baby scale. And also the bandage scissor. And there, following the kidney basin. Inside the kidney basin, we're going to put the cotton ball containers, which is the dry and wet, followed by the tape measure, and also the micropore, and the alcohol lamp with the match. We're going to put it inside a pouch. Lastly is the medicine cap. But we're going to also put the extra cotton fouet, and we also have tongue depressor here. This is followed by an empty pouch. Just gonna put it here. And the second pouch, which contains the cord clamps, suction bulb, and also if we have extra needles, we're going to put it here. Next will be the scissors, which is inside the muslin pouch 3 divider. This is already put inside A1 paper and with the 2 lines, which indicates it has to be put in an autoclave. Now, we're going to be putting the apron already. And lastly, to close the bag is our sanitation materials, which is the hand towel and the hand washing solution. And then let's close the bag. Then, we're gonna put here the plastic cover, but we're going to give a gap for us to easily get it. And then the manila paper or the paper lining. Here, we will be putting some sterile gloves. Our gauze. We have one clean glove here. And lastly is we have the extra plastic lining. Now we will be closing the bag. So now, since we are done with our CHN bag technique, we will be heading to our patient where we will be doing our urine testing and wound dressing or wound care procedure. Good morning, ma'am. I am Micaela Cobar, a second-year nursing student from University of Manila, and I am here to perform the urine testing and wound care procedure. Ma'am, mga tanong lang ko, ma'am. Asa ta pwede makahugas sa ating kamot, ma'am? Now, since we are done introducing ourselves to our patient, we will be preparing our materials. First is we will be getting our manila paper. And then our plastic lining. And let's put our CHN bag. Then we will open it and first get the plastic containing our hand towel and hand washing solution, and then our apron. Then close the bag. So now kay pagawas na tatong apron. Then, let's do our hand washing. Wadto na ta sa lugar kung asa ninyo ng patient pwede makahugas sa kamot. Then, since we are done with our hand washing, putan nila to siya sa kilid, including the plastic. And, let's wear our apron. So, mananatani. Let's open our bag again. and get the materials we will be needing for our urine testing and wound care procedure. The solutions, which is the Benedict, ENSS, betadine solution, acetic acid, or alcohol. Our specimen container. Open this. Our cotton balls, microspore, the test tubes, the dropper, the alcohol lamp and matches, our gloves. And that's all for now. Let's move on to our wound dressing or wound care procedure. First is we're going to hand wash our hands. Now, let's prepare the materials. Let's introduce ourselves and explain the procedure to our patient. Good morning, sir. I am Michaela Kubar from University of Cebu, Manila, and I'm going to perform the wound dressing and wound care now. So first, we are going to wear our clean gloves. Oh no. Now, we will be removing the gloves. Let's wipe it with cotton balls with alcohol first. And remove our clean gloves. Let's clean our hands again using hand washing and done on clean gloves again. Now, we will be getting our PNSS. Put it in our cotton ball. And wipe it first on the wound itself. Then drop. Then at the side, drop. On the other side, on the outer side. Then to the opposite side again. Since we are done with our PNSS, we will move on to our betadine cleanser. Again at the wound. On the side, so wound, and throw. On the side, and throw. On the outer side, then throw. On the opposite outer side, and throw. Let's close it. With the betadine solution in the wound, on the side, on the other side, opposite side. And since we already wiped the outer side of the opposite side, we're going to wipe the outer side in this area. And we're done putting all the necessary solutions in the wound of the patient. So now let's remove our gloves. And do hand washing. Don on clean gloves. And then start our wound dressing. fold this into half. Now, our wound dressing or wound care procedure is done. Medical hand washing. We are on to our third or last procedure, which is the urine testing. So first, we are going to gather materials. Next is introduce ourselves and explain the procedures to the patient. So, good morning ma'am. I am Micaela Cubar and I am from the University of Cebu, Manila, a second year nursing student, and I am here to perform your urine testing. So, let's start. First is hand washing. Then let's imagine that we already light the alcohol lamp since we will not actually light it for safety purposes. Then grab test tube and grab your test tube holder and get your test tube. First is we're going to do the Benedict's test. So we're going to put 5 cc of Benedict solution and then add 8 drops of urine. Next is we'll heat it in the alcohol lamp until it boils. Then let's let it cool in the glass. After letting it cool, we're going to compare it with our chart. On to the other half of our procedure, we're going to get the second test tube and put 5 cc of urine. then we're gonna heat it first in the alcohol lamp on the upper half side. After letting it heat, we are then going to add 3 drops of acetic acid. Then, heat it again. Still on the other upper half. Then, we're going to let it warm and cool. After letting it cool, again, we are going to compare it with our chart. So now we're done with our 2 tests, which is the Benedict and the acetic acid. Let's remove our gloves now. Do aftercare. Aftercare is we're going to document. Now we're on to our last step of all the procedures, the aftercare. So what we're gonna do is we're gonna return first the solutions. The alcohol, and put the alcohol lamp and match in its pouch. Also, the cotton ball containers, the micropore, the extra dropper. Put inside the hand towel and hand washing solution. So this. The urine chart. Lastly is the apron. Throw your waste receptacle inside your plastic bag. need a cotton ball with alcohol in the paper lining. Tie your bag consisting of all the used materials already. Then close your bag first. Then tie this at the back handle of your bag. Then wipe your plastic lining with the cotton your plastic lining. Put it back. Then we're going to close the bag already.